Imagine walking into a doctor's office in 2026. The doctor looks at your scans and says, "We know." That sounds amazing. It also sounds a little scary. Both of those feelings are entirely valid. Here is the twist the flashy headlines and social posts aren't mentioning. A faster diagnosis for multiple sclerosis may indeed be coming, but it's probably not coming the way you think. It is not some magical, one-and-done test. It is a fundamental shift in how doctors think, how they weigh evidence, and when they decide to act. Because yes, doctors may diagnose MS faster in 2026, but here's the twist. First, let's take a moment why diagnosing MS has been a marathon, not a sprint. MS is a tricky disease. It is an autoimmune condition where the immune system attacks myelin in the brain and spinal cord. Symptoms are incredibly varied and maddeningly vague. None of these signs scream MS on their own. Symptoms can mimic many other conditions, so doctors were cautious. A definitive diagnosis required dissemination in space and dissemination in time. Proving dissemination in time often meant waiting. You'd have a symptom, get an MRI, and hear, "Let's wait and see if something new happens in a few months." It became a dark joke. MS diagnosis moved at the speed of a Windows 95 startup. This caution wasn't to frustrate you. A misdiagnosis can mean unnecessary treatments and a heavy psychological and social burden. MRIs revolutionized diagnosis, but not all spots on an MRI are MS, and other conditions can look similar. So time became a tool. A new lesion later was the gold standard proof that the process was ongoing. Faster MS diagnosis. New criteria. AI will spot MS instantly. Those headlines are overblown. The real change is more subtle, more thoughtful, and ultimately more powerful. Not one single invention. Evolution in diagnostic criteria, improved tech, and a shift in care philosophy. The community is deciding that waiting risks often outweigh acting early, moving from reactive to proactive. Concrete change. Updating the McDonald criteria. Consortiums are refining the rules. Updates place more weight on specific subtle findings previously only suggestive. Example, oligoclonal bands in spinal fluid might fulfill dissemination in time on their own. That could mean no need to wait for a second clinical attack or a new MRI lesion if key markers are present. Tools are getting smarter. Higher resolution MRI, advanced sequences, AI to assist pattern recognition. Researchers are identifying biomarkers in blood or CSFs. It's like a liquid biopsy for MS. Confirming MS earlier or predicting severity sooner. The biggest change is the approach. Decades of diagnostic certainty are shifting to brain preservation. The evidence supports acting earlier. The big twist no one is shouting. A faster diagnosis does not automatically mean an easier diagnosis. Getting the MS label sooner means the emotional wait arrives sooner, even if symptoms are mild. That agonizing wait was also a buffer. It's a space to adjust. That buffer is about to get shorter. Faster diagnosis means earlier treatment decisions with a less complete picture. Doctors will use early signs, advanced imaging, and biomarker data to make a data-driven inference. The conversation shifts from, "We'll know for sure in 6 months," to "Signs point strongly to MS. Let's act now." You'll weigh benefits of early therapy, potential side effects, and the small chance it's something else. You must become an active partner, ask hard questions, and embrace a proactive strategy, less about prolonged limbo and more about an intense burst of education, decision-making, and adjustment. It's a trade-off, trading the pain of waiting for the challenge of acting decisively at the start. For many, this is welcome, but it comes with very human challenges we should acknowledge. Why faster is still better. The upside of early action. Time is brain. In MS, inflammation can damage nerves. Some damage can repair early, but repeated attacks cause permanent scarring and disability. Modern treatment aims to stop inflammation before lasting harm. Sooner treatment, better odds. Think of a small fire you want to extinguish early, which equals minimal damage. If you wait, the house is engulfed in flames. Early diagnosis and treatment are the extinguisher. You should act at the first signs of smoke. A clinical event plus a strong MRI or biomarker are evidence. This protects your ability to walk, think, and see so you can live independently for years. Ending diagnostic limbo can also bring profound relief and validation. Earlier diagnosis means earlier lifestyle changes, diet, exercise, stress management, vitamin D. It empowers you to be active from the start. It's about new growth and early potential. Practical steps for the new era. Start a simple symptom diary. Note what it felt like, where it was, when it started, and how long it lasted. Be the CEO of your records. Always get the MRI report and the actual images. Keep images on CD or download them. It's invaluable for second opinions. Expect your doctor to show the images. Ask, what makes that spot look like MS? Are there other possibilities? Discuss early treatment options. The benefits, common side effects, serious risks, and why acting now may help. You can ask for time to think or seek a second opinion. Good doctors support that. Aim for confidence in your plan, and keep that notes app handy. Let's cut through the noise. Not an instant, one-visit answer for everyone. It shortens timelines in clear-cut cases. Careful, thoughtful medicine remains the standard. No magic wand or single blood test. Not AI replacing your neurologist. AI assists. Humans make the clinical call, not diagnosing everyone with tingles. No one's labeling MS because your foot fell asleep. Rigorous differential diagnosis remains fundamental. Reality. Faster decisions for some AI assists. The goal is for earlier detection, not false labels. If you want MS updates explained without doom, hit the subscribe and like buttons. It really helps. The real meaning of progress. The landscape of MS diagnosis is changing, and it's changing for the better. Medicine is prioritizing long-term brain and spinal cord health by acting sooner to prevent damage. This is not a shortcut, it's a strategic shift in intention. The twist is that faster isn't easier. It's not a reason for fear. It's a call for partnership and clear decisions. No panic, real progress. Tell me, did your diagnosis take months or several years? Yes, doctors may diagnose MS faster in 2026. The twist, speed comes from philosophy. It's a choice to act earlier, a hopeful choice to protect your brain sooner. See you in the next one. Subscribe for calm, evidence-based updates.